What can I do about under eye skin, wrinkles, and thin skin?
Thank you for your question. You submitted your question with several photos, and you're asking what can you do about your under eye skin, about wrinkles and thin skin. And several of your photos you have from different angles and with expression and without expression. Well, I can certainly share with you how I counsel my patients who come in every day in my practice with exactly the same concerns. A little bit of background: I'm a board certified cosmetic surgeon and fellowship trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, customizing solutions to help people with wrinkles around their eyes, whether it's with injectables, with regenerative medicine technology, and of course the many lasers, has been an evolving and continuously interesting process that has helped me really optimize the treatment strategies for my patients over the past over 20 years in practice. So to begin with, I always try to help my patients learn some basic principles to help guide them before they jump on what is the latest and greatest gadget. So to begin with, it's very important to understand to distinguish dynamic wrinkles from static wrinkles. When you're smiling, when you're moving, and the skin appears to wrinkle more, you have to understand that there is a dynamic process there. So when I say dynamic, I'm basically talking about muscle action. So to help manage wrinkling from muscle action, use a neurotoxin such as Botox or Dysport. And that helps to diminish the intensity of the wrinkling with movement. That's fairly straightforward. And so it's been well established, particularly around the eyes, that it's very good for like crow's feet lines, as well as some activity of the muscle underneath the eyes. Now, when it comes to the quality of the under eye skin, I would say that a lot has been learned, at least from my perspective, over the years of different modalities being introduced. And in the mid-90s and in the late 90s, the procedure of choice was to use an ablative CO2 laser. And although it certainly worked very effectively, over the years what I realized, especially as people got older, that their skin continued to get thinner. And then you have to ask yourself, what's the upper limit? How much can you laser the under eye skin? The eyelid skin is the thinnest skin in the body. It is 0.5 millimeter in thickness. And so as time went on, of course, less aggressive ablative lasers like the erbium laser came along, and then came the fractional lasers. But further, it is what has helped me a lot in my practice has been a strategy where I try to help counteract the progressive thinning of the skin which occurs with aging. It is a commonly held belief in the medical community that after the age of 20 you lose 1% of collagen in the skin every year. Now that is very meaningful, so in a way you want to also try to be proactive and help build the skin and find ways to strengthen the skin. And this is where something called platelet-rich plasma, or PRP, comes into play. A lot of my patients who have quote crepey skin and fine wrinkled skin from aging as well as sun exposure and smoking, what I do is basically skin rehabilitation. We periodically inject with platelet-rich plasma under the skin to help build the skin up and to improve it. We can also employ even light microneedling or the use of a skin booster to help deliver collagen, or PRP, to stimulate collagen, as well as deliver hyaluronic acid within this very, very thin layer of skin. When it comes to also ways to stimulate skin with thermal energy, Well, we can do everything from a fractional CO2 laser, a fractional erbium laser, as well as this additional modalities such as long-pulsed erbium lasers that can be used to help tighten the skin or generate heat into the skin without taking off the top layers of skin. And that's also become another strategy that I've been employing to help manage the skin. Basically, you cannot eliminate it, but you can improve it. And the goal is to do as little significant trauma to the skin and do as much as you can that can sustain the skin quality for as long as possible. So it is very common for me to customize a treatment plan which involves the regular use of a neurotoxin, use of PRP, as well as the lasers, and depending on what kind of skin issue there is, whether it's a long pulsed erbium, fractional CO2, fractional erbium. But what I would just caution you is not to be overly aggressive. Patients come all the time who have had multiple lasers, who have had thermal energy devices, especially the more aggressive high intensity radiofrequency devices, and they often complain that their skin got worse, that the skin got crepier. And it's a very important detail to consider. Remember, the skin is so thin, it's 0.5 millimeter in thickness, it's practically transparent. It has to be treated very carefully, very gently. And you cannot eliminate wrinkling, but you can manage it. And so I think that this technology of regenerative medicine with platelet-rich plasma, for me, has been very, very useful. And it is also further important to understand that in addition to the wonderful interventions that we have, prevention is very, very important. So it is important to wear sunblock, protect your skin. The eyelid skin, as I said earlier, is the thinnest skin in the body, and it is vulnerable to a lot of environmental stressors, such as sun exposure and smoking. So meet with qualified, experienced doctors who can help you learn about these modalities. Be careful about not just jumping on the train of whatever the latest, greatest device is. If you've been around this field for any time, you have learned that things are literally hot for a while and then become very cold very quickly. And so it's important to find a doctor who has that experience and judgment to guide you in a way that is appropriate and ethical and will be in your best interest and with your understanding of the limitations. And that's very, very important. So I hope that was helpful. I wish you the best of luck. Thank you for your question.